Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I'm so pleased to be with you today for this next installment. I've been partnering with the Council on Aging in St. Tammany or COAST for over 10 years, all of that time as a caregiver support group facilitator, and for 5 of those 10 years as an educator bringing you Caregiver Coffee, so videos like this. Today's topic is going to be making the most of the visit, the visit with your doctor. So we'll be talking about an article that is on the NIH's website or National Institute of Health, and specifically the National Institute on Aging. So this was a really good article that is just basically how to have that great visit, because we know that many times we don't have a lot of time with the doctor. So it's best to be organized and to be open and to know what you're going to what you want to express to them so that you make the best use of that time. So this is based off an article, What Do I Need to Tell the Doctor? And we may jump to another one if we have time on a similar topic. So before we get to that, as usual, I want to tell you about our caregiver support group. They are held every Tuesday of the year, unless there's a holiday, and then even then we try not to cancel it. We move it before or after that, so we keep it. And the basic pattern of the caregiver support group is that the first Tuesday of the month is at the Slidell in person at the Slidell Activity Center on Cousin Street. The second Tuesday of the month, we are online, the virtual platform Zoom, which many of y'all are familiar with. People can join virtually using their computer or their smart tablet or their smartphone or even their landline phone. If you have one, you can just, or even your smartphone, you just dial the numbers like an old-fashioned phone conference call. So we have people joining in various modalities of all those. The third Tuesday of the month is in person, and we're at the Covington Senior Activity Center off of Highway 190. And then the fourth Tuesday of the month, we are back on Zoom. Now, some months do have 5 Tuesdays on them, and we usually play that by ear. Sometimes we take a break during that fifth Tuesday, or sometimes we actually do meet. And if we do meet, it's via Zoom. So because of holidays and fifth Tuesdays and all of that, it's a good idea to be a part of our private email list. So what you could do is join our email list, and then I email everybody, all 100 of the people that are on it, every Tuesday morning as a reminder, hey, we're meeting today and this is where. And I also send out the calendar. So let me tell you about the calendar. So every 2 months, we refresh the flyer that has the dates for the current 2 months. In order to get to that, you want to go to coastseniors.org, go to Caregiver Services, and then you can navigate to where you'll see a picture of me, and then there will be a link to a PDF. You can view or download that, and then on that, it will give you the dates, so you can actually print it out, put it on your refrigerator, stick it in your calendar. And then also on that flyer, it will give you the details on how to join that email group that I was talking about. And you stay on it as long as you want. You can always unsubscribe. And just remember, it is an email list that will really just tell you about the caregiver support group, reminders and updates. It's not regarding anything else for Coast. Although if there's an event coming up like a caregiver expo that they have every March, I will advertise that, or if there's special webinars that I think would be good for you to be aware of. I do send out information on that, but it's not a lot of emails. It's really just once a week. So consider doing that and consider joining us, the fellow caregivers of St. Tammany. So if you can't make Tuesdays, just let me know, and I can help you try to find another support group that you can make either virtual or in person. So, all right, with that, let's get started with this really important topic. So talking about your health means sharing information about how you feel physically, emotionally, and mentally. Knowing how to describe your symptoms and bring up these concerns with your doctor will help you partner with your physician or nurse practitioner. Now, there are worksheets that are linked into this particular NIH article. So there's gonna be a couple of things that I'll tell you about that you can link to, and that's one of them is a worksheet to kind of help you organize your questions and your thoughts before you go in there with the doctor. So number one, you want to share any symptoms that you have. A symptom is evidence of a disease or disorder in the body. Examples might be pain, fever, a lump or bump. It could be even be unexplained weight loss or weight gain, or even that you have trouble going asleep or staying asleep. Be clear and concise when describing your symptoms. Your description helps the doctor identify the problem. And of course, he or she will do a physical examination, but your description of the symptoms can certainly help them kind of fine tune and help them be alert to what they might be looking for. Some questions to ask yourself about the symptoms that that your medical provider will have are: what exactly are the symptoms? Are the symptoms constant? If not, when do you experience them? Is it certain times, or is it when doing certain motions or activities? Does anything that you do make the symptoms better? Do the symptoms affect your daily activities? And if so, which ones? So that's for sharing your symptoms. Next, you want to give them all the information that you can about your medications. And we've talked about this in our medication section or our medication playlist about the 4Ms, the second one being medication, that you want to make sure that you're avoiding serious side effects of the medications. And it starts with letting your doctor know about the prescription ones. Of course, he or she's going to have the medical record right there on the computer. But the prescription drugs, which will be in the system, the over-the-counter drugs, which may or may not be in your patient record, and then any supplements or herbals that you might be taking. Those are things that they do need to know about. They may not remember to ask you if you are taking any vitamins or herbals, but they definitely want to know and need to know because they want to avoid any reaction or side effects between even those items. So it's important to make a list, and you can also bring in, they call a brown bag, a brown bag visit. You basically throw all of your medications and herbals and vitamins and supplements into a brown paper bag, and you bring it to them so it's right there in front of them. And you want to make sure that you're also including laxatives if you regularly take a laxative, eye drops. So I mean anything that you're consuming or putting on your body, you want to let them know. And this is a place in the article where there's actually a medications worksheet that you can take advantage of that will help you stay really organized in that. Third, tell the doctor about your health habits. In order to provide the best care, they must understand you as a person and what your life is like. So, do you work? Are you retired? If you're retired, or even if you work, do you travel a lot? How do you eat in general? What are your sleep patterns like? What activities do you enjoy? What is your sex life like? Be open and honest with your doctor. I mean, of course, everything that you say there in the room is confidential, and all of it is really important. So he or she gets a complete picture of who you are and what's important to you. And this brings us back to the first M, which is what matters most. And when the doctor knows your life priorities and your context, they can tie that in with your health goals and what's important to you. Next is share other concerns in your life with your doctor. So your health has a big impact on the parts of your life, and your doctor may ask how your life is going, just in general. And they're not being impolite or nosy. They know that the information of what's going on in your life may be useful to them medically when giving you information. So let the doctor know if there are any stresses, many major stresses in your life, such as a divorce or a death of a loved one, a move, loss of a job. All these major stressors can make an impact on your health, and it gives them context to your life and what's important and what's going on. You may have concerns about or wishes about the care if you become seriously ill, and you may have questions about the choices that you have. So it's important that at this time you also have a conversation about who would make healthcare decisions for you if you were to unfortunately get into an accident and you can't speak for yourself. And this is for, I mean, I think when we talk about having a healthcare proxy or a power of attorney, we think of someone who is older, but really anybody who is 18 and up should have someone who has been designated as being able to speak on behalf of that person. Now, if something happens. Now, many times it ends up being a spouse, and if there's no spouse, it ends up being adult children or a friend. But it's really important for you to name that person, that healthcare proxy, and the next step is to make your wishes known to that person so they know your values and they know how you want to be treated if there are decisions to be made. Now, sometimes there are not decisions that need to be made. It's pretty clear, but in the event that that decisions do need to be made, having that conversation before is really important. And that type of information will also be in the medical record. So your healthcare power of attorney should be listed in your medical profile. Now, while we call it healthcare proxy and sometimes call it power of attorney, you don't have to see an attorney to actually designate that person. It is recommended that it's in writing so that that person can say, yes, I am able to do this. But and there are forms online, but you don't need to have anything drawn up by an attorney, although that's an option. And you don't have to have anything notarized. And that's an option as well. So I'm going to jump to this infographic right here. So these are ideas on how to prepare for a doctor's appointment. And that's the actual name of this particular article. All right, and I'm just checking my time because I don't want to go too long. I'm going to wrap up in about 5 minutes. So make a list and prioritize your concerns. Do you want to get a flu shot? Do you have concerns about things in the future, things you see in the news? Do you have concerns about a family history of something? So let them know what your questions are and prioritize those concerns. Because as mentioned, unless you have an hour-long, appointment, which is a great amount of time to have. It's wonderful if you do, but if you don't, like most of us, it's like 20 minutes, 30 minutes. You really need to be there and have yourself organized so you get to ask all the questions. Now, there may be opportunities to ask questions afterwards, and that's something that you can kind of work out with them or ask them what's the best way to do that. Take information with you to the doctor. So we already talked about the medications, but I would recommend if you see any articles that you have concern about that might impact you, bring that article. And I would say even go the next step, and if you can, go to Google Scholar, that search engine online, and look up references and the research articles that are tied with that popular article that you might have. Next, consider bringing a family member or a friend to your doctor's visit. Now, there are some advantages to doing this. It brings another perspective, another set of ears and eyes, and so they can also help you sort of like you can discuss things with them afterwards because they've heard everything that the doctor and the nurse has said to you as well. Now, especially as if you have complex medical conditions, it's very advantageous to bring somebody with you to be an advocate and to be somebody who can bring in another perspective, maybe ask some questions that you did not or would not have thought about. So that is something to consider. If you're ever getting started with a new doctor, there are some tips here. Introduce yourself. When you see the doctor and the office staff, introduce yourself and let them know your name and what you prefer to be called. Ask how the office runs. Learn what days are the busiest, maybe what times are the best to call. And how often does the doctor or nurse check messages in the online portal if you're able to do that? Because many times that can be faster than waiting on a phone call. Although a phone call can be wonderful because you get to ask, you can ask questions right away instead of waiting for a message to come back. Let's see, share your medical history. And typically they'll ask you that. They'll even ask you your history, but also on your mom's side, on your dad's side, what kind of diseases, maybe if they are no longer with you, how did they pass away? That's going to give the doctor some good information. And then share the former names of doctors if you're comfortable doing that, like who you saw before, and possibly they will want to request that medical records be brought in if you are going from one health system that has their medical record system to a different health system that has their medical records. You want to let your doctor know if there have been any significant changes. And this is very similar to the previous article we just talked about. Significant life events are really important. Be sure that you can see and hear as well as possible. So many older people use glasses or they use hearing aids to hear. Remember to take your eyeglasses and your hearing aid with you. And I know this sounds like common sense, but I think it's a good reminder that they have here that you're utilizing these appliances, as they call them, to help you understand everything and to hear everything. Request an interpreter if you need one. And at the end of the article, there's a link to more worksheets and similar things that are going to help you to have the best doctor's visit as possible. So yeah, so I hope this is helpful for you. It's so important that you know how to communicate with your doctor, how you come prepared to that with your concerns, because you may have a lot, but then a short amount of time, a lot of concerns, but a short amount of time. So I encourage you to do that. I encourage you to help the rest of your family, your parents or your siblings, and maybe send them this video or this article that'll be linked in the video description, so you can so they can also get the most out of their doctor's visit. And one last thing is, I know I mentioned the portal before, but even if you're not tech savvy, and you might feel intimidated about getting onto the online portal that your health system has, I encourage you to look further into that. It is worth it. It lets you get in touch with them when it may be difficult to receive a phone call, and they can kind of get back to you. Sometimes it's easier for them just to type a message, but then also if you need to talk with them, let them know in that message. Many times, if you are having difficulty with that, the particular health system or doctor's office will have other staff in the organization that can help you get set up and answer all your questions. So all you got to do is ask, and you'll probably get lots of help with that. So, all right. Well, thank you for joining me for this Caregiver Coffee. I look forward to being on your screen sometime in the future with more Caregiver Coffees and tips on healthy aging, on caregiving, and staying independent as much as it makes sense, as long as it makes sense. All right, y'all. Take care, and I will look forward to seeing you next time. Bye for now.